Good evening to all of you. I'm also live streaming it on YouTube so that the benefit can reach more people. Today is International Epilepsy Day. The second Monday of February is celebrated all over the world as International Epilepsy Day. So as part of our celebration, we are doing this presentation today. So let us get started. I will just start sharing my screen and we'll get going. Yes, those of you who know me know that I work at Kaveri Hospital, Chennai, that I'm also at the VHS Hospital, and I started a center called Epi Center in 1994, and I continue to do that work through the hospitals to which I'm attached at the moment. Before I had a standalone center, but now I do the work through these two hospitals where I'm attached. I already told you today is International Epilepsy Day, and as part of the celebration, we are doing this program. So I started Epicenter in 1994, March 9th. That period from 1990 to 2000 was celebrated world over as the decade of the brain. And the two organizations, the International League Against Epilepsy and the International Bureau for Epilepsy. The International League Against Epilepsy consists of doctors and scientists who are working with epilepsy. The International Bureau of Epilepsy is people who are supporting the cause of epilepsy. They are patients, families, employees, etc., who constitute that organization. They launched a public health imperative called Bringing Epilepsy Out of the Shadows. And the whole idea of that was to create awareness about epilepsy. And the focus also was, in many developing countries, there was a treatment gap, that many people would have epilepsy, but they would not have access to treatment. And so a lot of major steps were taken in the world in the field of epileptology during that period. And in general, the statistics about epilepsy are, that one seizure in a lifetime can happen in so many people. There are so many people living with active epilepsy. People with epilepsy in developing countries constitute such a large chunk of the 50 million people. There are 2.5 million new cases each year. 80% of the anticonvulsants sold are available only in 20% of the countries. 70% of people with epilepsy can be seizure-free with treatment, but many people don't know that. And 80% are not even properly diagnosed and not treated. So we need to understand that this campaign of epilepsy out of the shadows was created in order to eliminate all this ignorance that was there in association with the knowledge of epilepsy. So when we admit somebody, this will hang. Okay. But what is more important is that epilepsy is all over the world, no matter how developed the nation, is associated with a lot of fear, suspicion, misunderstanding, and people with epilepsy suffer a lot of social stigma. In many places, they're treated as outcasts. In some communities, they are punished. In some communities, demons are driven out of them. And there were very famous people, great people like Julius Caesar and the great Tsar of Russia, Pope Pius IX, a lot of poets, a lot of people, a lot of famous people have had epilepsy. And the theme for this year, for International Epilepsy Day, is to end stigma. So did you know that stigma and discrimination against people is very widespread? And that can impair the quality of life and the social well-being and the healthcare seeking of people with epilepsy. What we need to propagate and tell as many people as possible who misunderstand what is epilepsy is that it's a treatable condition and that 1 in 150 people all over the world suffer from epilepsy, and 70% of people with epilepsy can become seizure-free with a proper diagnosis, cost-effective and commonly available anti-seizure medication. Epilepsy has been known for thousands of years. Even in Ayurveda, in the Charaka Samhita, which is the abundant references of epilepsy are there about the symptoms, about the etiology, about the cause of this, how to diagnose, how to treat. In Ayurveda and in Sanskrit, it has been called as apasmara, which is loss of consciousness. Hippocrates knew about epilepsy and he said it is not a sacred disease as it was believed before that, but he said it's a disorder of the brain. And while both of them took away this demons and spirits view, they're more than 2000 years, even today, there are many communities and cultures where they drive the devil out of a person who has epilepsy, thinking Peyi, Buddha, something has possessed them. What we are looking at is to promote advocacy for people with epilepsy and give them quality of life so that they can study, they can work, they can lead fruitful lives, and they can marry, they can have children, and they can have a full life like everybody. Education and employment can be very much a part of the life of a person with epilepsy. Women and men can marry, they can have children. And we have done a lot of programs in the past as Epicenter, where in 2007 we celebrated Epicenter, the Epilepsy Day. We targeted teachers and young school children. We had a painting competition. We talked about epilepsy to them, then asked them to draw a poster which they would like with all the concepts of the epilepsy that they had heard. Then we had judged that, had a painting competition. Then we have coordinated with Krishnamacharya Yoga Mandiram, where we have taught yoga to people with epilepsy and calmed them down so that their anxiety levels have come down. Then we did a walk in the beach on Epilepsy Day 2004. I went to 9 or 10 schools, talked to the 9th and 10th standard children. Then we talked to the teachers. Then each school sent 10 representatives. We carried banners about the positive things that are possible for people with epilepsy. And we walked in the beach from this arch right up to the Gandhi statue. Then we also targeted school teachers because many school teachers were saying in the Kulandhikku Paduppu Venuma, and they were sending children with epilepsy out of the school. So we did a lot of propaganda and worked with school teachers and taught them. And this is them doing a skit after the program. We had a skit competition where they had to do a skit about epilepsy, where they talk about the knowledge they have about epilepsy. Then there was an orphanage, Balamandir orphanage. We talked to all the orphans there about epilepsy. We called the MD of an exclusive international residential school who accepts students with epilepsy. We asked him to be our chief guest so that he could say that epilepsy is just another disorder of the brain and that it is not anything that you have to be afraid of. But what the problem is, very often, more than 70% of patients who have epilepsy, we do not know the cause. We know the cause only in about 30% of patients. But what we know now with a lot of scientific advancement is what actually happens in the brain. Some kind of insult happens, an oxygen lack, a physical injury, a tumor, a blood circulation problem, whatever. That leads to a seizure. Now, what happens in the cellular level? There's a lot of changes that happen. The receptors change, the ion channels change, neurons are lost, new neurons are created, and that whole area is reorganized. But it is reorganized in an abnormal way. And this increases the excitability and it produces the seizure. So we know the pathogenesis of how a seizure is produced in the brain. And we have come a long way. We know that in children, epilepsy is a little different, that there are more genetic causes in young children. We know that epilepsy is commonest between the ages of from birth to about 10 to 15 years. We know that epilepsy is more common in the 60 plus. We have advanced a lot on treating and taking care of women with epilepsy who are pregnant and they can have babies. And we have a lot of, we know about the infections. Tapeworm infestation is a very common cause of seizures in our country. There are also brain fevers, infections in the brain, head injuries, birth injuries, lack of oxygen, lack of B6, low sugar, all of these can cause seizures. After a stroke, seizures can occur. After the degeneration of the brain with Alzheimer's disease, there again you can get seizures. So the WHO, they said we'll just take a few causes which we know and focus on those causes to manage people with epilepsy. So one was head injury. So they launched a program for avoiding head injury. You wear a helmet when you go on a cycle. You wear a helmet when you go on a two-wheeler. You wear a seatbelt when you're driving. Then the safety things that come up, that airbag which comes when you meet with an accident in a car. All of those were targeted to preventing and reducing brain injury due to head injury, traumatic brain injury. Then the lot of toxic factors. There are a lot of toxins which can create seizures. Then the focus was on preventing infections and parasitic diseases. In young children, febrile fits. So when you control the fever, you'll find that the fits can be controlled. So febrile convulsions and management of febrile convulsions. Then taking care of maternal and child health care during delivery. So we prevent brain injury happening during labor. At birth, we protect the child from having an oxygen lack. We prevent infections during pregnancy. And a small amount are genetic factors. Some genetic factors, we counsel them not to have children, but most of them are still not very clear about what is the genetic factors in many of the epilepsies. So WHO came up with 6 basic preventions that we could focus on. They said, give all pregnant women very good prenatal care. Ensure they have safe delivery. In young children, control fever. Reduce brain injury. Control parasitic and infectious diseases. And in specific instances, do genetic counseling. If we do this, we can avoid people from getting epilepsy in many cases. Now, we know today it is no more demons, no more spirits, no more witchcraft. There's a lot of hope, there are a lot of skills, there's a lot of expertise in managing epilepsy. So let's look at some of these. See, epilepsy is actually a brain disorder. The electrical rhythm is disturbed. You see it outside like a jerking like this. In the substance of the brain, there is an electrochemical reaction which is taking place, which is causing the fit. And each part of the brain can produce a different type of fit. We won't go into these details because that's not the chief goal of this. I'm just giving you the background first. So how do seizures occur? They start in the center of the brain. They go to both sides, then you get a generalized fit. If it starts in a particular area and goes to only one side, you get a focal fit. This focal fit can stay in one side or it can spread to both sides. And it can be primarily generalized, it can be secondarily generalized. It's enough if you know it this way. There are focal, one part of the body, and generalized, whole body. We now have a lot of advances. We know a lot about the chromosomes. We know a lot about genetic factors in epilepsy. We've got advances with video EEG. We have got ways of operating on the brain and hitting targets without actually having to do a major operation. Just make a small burr hole, then use a stereotactic frame, target a place. Then we have found with excellent neuroimaging, we are able to identify scars and damaged portions of the brain. And we have a lot of newer drugs. Then we have something called vagal nerve stimulation, which also helps to treat epilepsy, which is not getting better with drugs. We have neuroimaging like FDG PET scans, which actually show us the brain while it is doing something. So when a seizure is occurring, we can measure which are the parts of the brain which are not getting enough blood flow. And we have epilepsy surgery as well as an advance. Now, the basic test that is done for diagnosing epilepsy is called an EEG. It's an electroencephalogram, just like an ECG or an electrocardiogram for the heart. In the brain, we'll see where different kinds of reactions and changes like this. These are all typical seizure discharges, and we are specialized in studying and looking at that. The recent advance is a video EEG telemetry, where the patient is being videoed throughout, where for a prolonged recording. We record for 4 hours, 6 hours, overnight, sometimes 3 days, 1 week even. And that is time locked with the EEG. So when the patient has a fit, we capture the image of the patient having a fit, a video, And time locked to that, we know what is happening in the brain and the EEG. I told you about the neuroimaging test. Primary neuroimaging, which we want for all patients, is a MRI brain, which we called as it's not a routine MRI. It's called an epilepsy protocol. Special cuts, thin cuts are taken so that we're able to study the brain better. And when we want to study the function of the brain, we do what is called as an FDG PET scan. And of course, we measure the cognitive and behavioral evaluation of the patient as well, which is called, we do a neuropsychological evaluation to see which part of the brain is being damaged or which part of the brain is functioning well. And especially when we undertake a patient for epilepsy surgery, this becomes very crucial to know exactly which are the parts of the brain so that we don't cause any damage when we are doing the surgery. Now, in all patients with epilepsy, they have the basic physiological needs, which all of us have. We need food, we need shelter, we need safety, security, love, belonging, and self-esteem. But this is lacking in many patients, and this is how they get very frustrated. I need to be excused for just a moment. I'm just suspending this thing temporarily. I'll be back in just a second. My apologies for that. Actually, I'm a little unwell today, but that's okay. So in men with epilepsy, we have to look into their education, their ability to work, their care when they are older and when they have to get married, and so that they don't face problems during marriage. In women, there is a type of epilepsy that can occur during the periods, which is called catamenial epilepsy. So that is something that we have to treat in young people. And due to hormonal changes, they can get certain complications like PCOD or polycystic ovarian disease. Taking care of the pregnant woman with epilepsy, we have advanced tremendously. Women with epilepsy in modern medicines can breastfeed. Elderly women, postmenopausal, they have a better, they improve in their epilepsy actually in many patients. And of course, the young woman, we make her functional so that she can have a full life like everyone with everyone. We have got tremendous advances in maternal and child care, and women with epilepsy need not fear. We can take very good care of them together with their obstetrician. The new treatment, the diet treatment, this was a very old treatment. It went away, but it's come back. It's called the ketogenic diet in children with epilepsy, which are difficult to treat. When we change them to a ketogenic diet, now everybody knows about ketogenic diet as a weight loss fad. So when we change them to a ketogenic diet, which is high fat and very low carbohydrate, their seizures improve. We are still not sure how and why this occurs, but this is a known fact for a very long time. So actually, even Hippocrates said that when he starved patients, their fits got better. So this has been explored over the years. And right now we have very clear guidelines for ketogenic diet in children with epilepsy. And it also helps some adults with difficult to treat epilepsy. So typical calorie distribution of a ketogenic diet will be 20% will be from protein, 75% from fat, and only 5% from carbohydrate. So children improve remarkably, and seizures can really be controlled well together with the medication. But still, the mainstay of epilepsy treatment are drugs. So what is the role of parents if they have a child with epilepsy? Now, children with epilepsy can have a lot of behavior problems. They can have difficulty with attention and concentration. And this is partly because of the disease itself and also partly because of the treatment. Very frequently, associated things are there in children with epilepsy. They may be hyperactive. They may have attention deficit. They may have mental backwardness. So it all depends on the reason why the patient is having epilepsy. And most of these children are very anxious. They can be irritable. They can be aggressive. They have very poor social skills because they don't want to mingle with other children. They can be very impulsive. They can lack motivation and energy. They have mood swings. They can get depressed. And sometimes they're not able to plan to do anything. They're not able to organize their behavior better. So it's very crucial that parents support children who have epilepsy. There are parents who have said, I'm ashamed my child has got epilepsy. There are parents who are in utter panic because the child has got epilepsy. There are parents who don't let the child even look this side, turn that side, move this side, because they are so worried about something will happen to the child. Then there are parents who neglect the children, who just say, no, there are men who have abandoned their wives and left just because the child has got a cerebral palsy or a epilepsy or something, as if he was not in any way responsible for the child having the illness. So parents play a very, very important role in removing stigma. So what we have is, more commonly we see overprotective parents. These parents are called helicopter parents. They have an incredible desire to protect the child. And they are very obsessed that the world outside is a cruel world and it's going to harm the child. And so they shield their child from the world. And they shield their child from everything and everyone. So the child is growing up in a very cloistered environment, only interacting with the mother and father, only with the family. And this is not at all good to develop social skills in any patient, in any individual. So what does the overprotective parent usually do? They'll, romba konji kulavi, they make the child feel that they can ask for anything they want. And make some children actually use this to blackmail the parents. So they get all the attention in the house and they avoid any disappointments for them. And they learn that by themselves, they can't look after themselves. That somebody should always come and look after them. They satisfy their every need. But when these children grow up and they're teenagers, they're a handful to manage. And then the parents get very upset and come to us. But from childhood, we should try to treat them as normal children within the limitations of the epilepsy. So this is a very important thing to remember. See, sometimes parents are doing this. They wrap them in plastic wrap and they negotiate for the child. They keep on giving instant gratification for everything. So you're completely ruining the progress that child can make. What are the potential symptoms of being a helicopter parent? What you do is you're overprotective. And when you are overprotective, you also put too much pressure on the child. You micromanage everything. And you're always anxious. That is the way you start off your intense desire to provide a childhood for your child different from your own. So these are all, if you've got any of these happening in you, please understand that you may be doing a overprotective kind of attitude towards your children. And this is applicable even to normal children. There are parents who completely do helicopter parenting even of normal children. So what is the consequence of this? The child doesn't develop its cognitive skills. It's not able to face risk. It doesn't know how to manage stress. So when you take too much care of your children, protect them from setbacks, they don't know how to deal with a setback when it happens. They're not able to make their own decisions. They're not able to make mistakes and learn from it. They're not permitted to fail. They're not able to learn valuable lessons And later on in life, they find it very difficult to handle any adversity. And we all know that life happens to all of us. Adversity can happen to all of us. Challenges can happen to all of us. And if you're not equipped in adulthood to manage this, and you also have epilepsy to boot, you're going to have a very poor quality of life. Mental health problems, low self-confidence, lack of social skills. And some of these children, because they have given so much, what happens to them? They become arrogant. They're demanding, manipulative. They blackmail everybody and everything around them. But what, if you look at an empathy factor, these are what parents who have a child with epilepsy say, why sometimes that they are overprotective, or why sometimes they, are so terrified. They say, I'm afraid to let them be away from me, never knowing when the next one will happen. And another person says that when my child has epilepsy, it's like parenting any other child, but there is a fear that a seizure will happen when you're not there to help. This is a sensible parent. This is not a helicopter parent. Constantly calling to the child in the other room to ask them if they're okay. That is a helicopter parent. Inside, you may fear the good fun times because you never know when the hammer drops. Everything changes quickly. Some parents are very concerned about what the public will think of, especially if it's a girl child with epilepsy. They're very worried what other people will think, because tomorrow they have to get her married and they think it will work against her. So living with a child of epilepsy is fearing that you're afraid to leave them to play alone in their own bedroom because they may commit suicide, especially teenagers. Fear, anxiety, depression, all of these are very real in parents when a child has epilepsy. See, all the time checking in the car also, if the child is sitting in the back seat, you keep stopping and checking if they're all right. You feel very sad that the child is missing out on so many things, or is so tired from the seizure, or is lethargic from the medication, and you just are terrified that they might get hurt. It's hard and sad to see a child go through something you cannot help them through, and you hear them moaning in pain. So the constant anxiety of waiting for the next seizure. Now that is the reason why parents sometimes overdo the protective behavior. Now what we need to understand is, when a child has epilepsy, support has to come from, we have to teach the child, we have to teach them how to run their lives. We have to teach them that there are certain barriers, certain precautions they themselves can take. We need the support of the family. We need the support of the community. And it's just not enough if the healthcare system is giving you the support. So we need to look at all factors. One second, I'll switch off this phone. Yeah. And we have to make sure that there is adequate adherence to the anti-epileptic medication, the ketogenic diet if they're on that, which is a hard diet to follow, by the way. And being alert and aware about the seizure triggers and knowing how to avoid those. So when you talk to young children about epilepsy, it's very important for older people talking to young children that use very optimistic language, use positive language, tell them you're not alone, that there are other people in the world also who have epilepsy. Tell them it's a brain disorder. It is not as if you're possessed with the devil or something. Talk in simple language, age-appropriate language. And tell the child, if you're feeling bad about something, express it. Tell us so that we can help you. And try to tell them as stories. I've got a lot of comic books kind of thing, which I have brought from abroad, which tell stories about somebody having epilepsy and taking them through all the various requirements, usually, which we have for that. And provide children also with information. Don't think he's only a child, I'll only talk to the parent, I won't talk to the child. And also talk to them about the importance of taking the medication, importance that if they adhere to the medication and are seizure-free for 3 to 5 years, there's a good chance of us stopping or reducing the medicine in 70% of people. So how can a parent with a child with epilepsy support them? Get your child tested if they have any other associated learning disabilities, which can frequently accompany epilepsy. Talk to the teachers about the academic needs of the child. Encourage the child's friends, peers, everybody to help the child, because children can be very kind, they can be very cruel also. So children can sometimes make fun of a child when she's having epilepsy, and that can completely take away the self-esteem of this child with epilepsy. Look out for support groups where people of like my parents, other parents are also there, and you're able to talk to them. Talk to your doctor and make sure that your child takes the medication. This is a very, very important way as a parent you can support your child with epilepsy. Then we also have to look at the contribution of the brothers and sisters of a child with epilepsy, the siblings. In general, there was a study done, and it was found that in general, the siblings are more protective rather than feeling resentful about the child with epilepsy. 56% said that the sibling worries the child with epilepsy will have a seizure. They're also afraid she will get a seizure. 46% are concerned that epilepsy may be causing pain in them, or that the brother or sister is suffering during a seizure. 43% said they are very proud of the child with epilepsy because of the way they are coping and managing and living their lives. 64% said they feel very protective of the child with epilepsy. So contrary to common thought, the siblings can be also used by the parent as a support mechanism. Because when a younger child talks to a younger child, they are more likely to listen and they are more likely to cooperate than when an adult talks to a child. Negative feelings, yes, there are negative feelings in some sibling relationships. Even in normal siblings, we know sibling rivalry. That is, one child feels that they're getting more attention or they're not being attended to enough. 15% said the child with epilepsy is getting more attention and they don't like it. 8% they hide the epilepsy. They don't tell outsiders that their brother or sister has got epilepsy. 11% they say, why is it that they get everything they want? They get all the facilities. I don't get anything. They get angry, and they may actually be aggressive towards the child with epilepsy. So it's very important to help siblings to understand. So we have to talk to the siblings, tell them what is a seizure, explain to them what is happening, and tell them how to help. And then you will get their cooperation. One of the ways we do work with siblings and children and peer groups in schools is we teach them to recognize the common symptoms which could be a seizure. So we tell them if the person is just having a blank stare, or if they're making chewing movements like this, like that, or they're talking and then suddenly they start fumbling, or they just move around from place to place, they wander around, or they start twitching, or their speech gets very confused. You tell them maybe they are having a fit. So call an adult or call your school nurse or call the teacher or inform a parent or understand that this may not be a normal thing. Then we also tell them how to take care of the person if they watch somebody having a fit. This lesson is for all people. When a person is having a seizure, please lower them to the ground. They cannot fall from the ground. Turn them to the side like this. This is called the recovery position, so that when saliva comes out of the mouth, it doesn't go into the lung and choke them. It will come out. Sometimes people even vomit during a seizure. So if you put them in this position, put something soft under the head, because when the head is jerking like that and it hits the floor, you can cause a blunt head injury. So keep something soft under the head. There is no need to hold down the arms and the legs and everything. They will flail up and down for a while. Most seizures will stop in 1.5 to 2 minutes. So the first aid for seizures: speak calmly, clear a crowd, don't grab or hold the patient, explain to others, this is a seizure, it will soon be over, don't worry. And if there are any hazards nearby where by kicking or waving their hands, they can get hit and get hurt. And if you time the seizure, it is useful for the doctor to interpret it. So again, we put pictures like this in schools where children can understand a blank stare, wandering, shaking, all this thing. And also the first 8 steps, we give them stepwise what they can do. When do you have to call a doctor or an ambulance when somebody is having an epileptic seizure? If it is somebody who has never had a seizure, who's having a seizure for the first time. if a lot of seizures are occurring one after the other very rapidly in rapid succession, if the person who's having the seizure says, look, please call a doctor, I need a doctor. If the seizure lasts for more than 5 minutes, and if the person has any trouble breathing, or they're choking, or they're getting blue in the face, or getting pale in the face, and the seizures are occurring much closer together than normal, all of these are telling you that this seizure could be a serious seizure. It can endanger life, and that you need to call an ambulance or a doctor. Now, what we're trying to do through all these awareness programs is, most people, when we are diagnosed with epilepsy, they make this part of their life as epilepsy and this part of their life as life. We have to flip the switch. Life is your main life, and epilepsy is only a small part of your life which you can keep under control, under your foot. And we are there to help you, guide you. And today's world, you can live a really excellent quality of life in spite of the epilepsy. So the first step in finding a cure is to spread awareness. And there are a lot of days for breast cancer. There is October is called, it's celebrated with pink. In December, AIDS is celebrated with a red ribbon. The color for epilepsy celebration is a purple ribbon. And November is considered to be the National Epilepsy Awareness Month. But International Epilepsy Day is the second Monday in February. We have one more day called on March 26th, which is called Purple Day. Now, by celebrating all these days, we all seize various opportunities to educate the public on what epilepsy is. So we try to educate, we try to empower families and people who have epilepsy. And we want to encourage people with epilepsy that other people will be there to help them and take them through their problem. So today I want to make an appeal to all of you. Help us bring epilepsy out of the shadows and make people with epilepsy live a full life with everyone, like everyone, in spite of epilepsy. So in VHS, now we are running on Tuesdays and Thursdays from 10:30 to 1:30, a difficult to treat epilepsy clinic. The reason why we have segregated the difficult to treat patients is, these are patients who don't respond to 4 to 5 drugs, who have more than 2 seizures a month, even though they are on more than 2 drugs per month, and they are under treatment for more than 2 years. Now, these patients, if we do what is called as a pre-surgical evaluation with a good MRI, a good PET scan, with good video EEG, a good neuropsychological evaluation, a good study of the actual seizure itself, we can shortlist them. They may be suitable candidates for epilepsy surgery. Many people don't know that epilepsy can be treated by surgery. Now, if you're a suitable case for epilepsy surgery is the next best thing to a permanent cure. Because as many people explain to people, no brain is better than bad brain. Now, the epileptogenic brain is bad brain. It's going on. It's like a naughty child in a classroom of students. The naughty child is not only not learning, he's interfering with the learning of other people. So the epileptogenic zone in the brain does the same thing. Not only it's not discharging normally, it is giving abnormal discharges. It is also spreading to the rest of the brain. And sometimes when we see a patient with frequent seizures, it will look as if they are mentally backward. But once you control the seizures, the brain will blossom. Actually, they're not mentally backward. It is this seizure-genic zone that has been interfering with the brain function. So we've started the difficult to treat epilepsy clinic. It's a special clinic. And that is the phone number for the secretary, if any of you need to seek a consultation or an appointment there. It is on Tuesdays and Thursdays from 10:30 a.m. to 1:30 p.m. in VHS Hospital in Taramani. So with this, I hope I have my appeal to all of you to support epilepsy and people with epilepsy, remove stigma. I hope I have fulfilled the task of attempting to remove stigma in people with epilepsy on International Epilepsy Day. Please put on your videos, and if you have any questions, I'm willing to answer. put on your video so I can see you. Yeah. Suganya Subbarao, video please. So there were people who joined and dropped out also. Maybe they're having internet issues. Any questions? Crystal clear. Venkatesh, any questions? Unmute yourselves and ask if you want to. Unmute yourself, madam.
Yeah.
Solunga.
I just want to thank you, doctor, for all the improvement in last 20 years, actually. Because he has been patient almost 22 years, actually. And there has been almost like 98% improvement. That is really, actually, you're like a god. Actually, for me, I'm personally thanking you for all the help we got, actually, for the right doctor, right treatment. And he has been very good discipline in taking medicine, taking care of his health, and all the family support he's getting from everybody. Thank you very much. I just wanted to thank you.
Thank you. Thank you for that. Actually, that is why we want to emphasize that everybody can contribute to help the person with epilepsy to get a good quality of life. See, he has been working. He is everything. He's leading a near normal life.
Yes.
Saumi, you tell.
Auntie. It's the same with me, Auntie. I was your patient since I was in school. I was in standard 4, I think. So from that time, I have been taking medicines, and my parents, everybody, my relatives helped me. Thanks to you, Auntie. You are you have saved my life. Now I stay in Hyderabad. I'm working in Facebook now. You already know that. I'm staying alone. I stay away from my parents, but I lead genuinely a good life. Thanks to Dr. Auntie.
That is what it is. The idea is you can live a full life with everyone, like everyone, in spite of epilepsy.
Yes,
so that
Auntie.
is the message that we are trying to convey. Suganya, do you want to ask anything?
In my workplace also, Auntie. In my office also, I convey this message that this is not a stigma anymore.
Exactly. And if each one of you talks to 10 people, there's a ripple effect of education, empowerment, and encouragement. Janaki, நீங்க ஏதாவது கேள்வி கேட்கணுமா?
Yeah. As a teacher, I will just create an awareness in my school. Thank you.
Thank you very much. Suganya, நீங்க ஏதாவது கேள்வி கேட்கணுமா? Suganya Subbarao, ఏమైనా అడగాలా? They prefer to be silent. Okay.
Yes,
go ahead.
I have already seen to my leg now. I already up to 65. I'm quite fine now. But I cannot want to say that I am a helicopter grandparent now. But society is now that how best are the chances that one grandchild or thereafter their generation they have the possibility of this?
No, see, even though there's no family history, 1 in 150 people all over the world are likely to get epilepsy. 1 in 10 of us can have a seizure due to some provocation. So it's quite a common condition. And just because you had it, there is no clear genetic, except in few epilepsy syndromes, we are not able to see a clear genetic pattern which we can tell you, okay, if you have this, so many will have, so many will not have, like we can do in some other genetic conditions. So don't worry. And like I said, if we look after maternal and child health care, the delivery is looked after, the child is born at term, and postnatal care is given. Everything is, we look after the health of the child, avoid head injuries. All of these will actually, epilepsy incidents can come down. It can come down. Sugandhya, நீங்க ஏதோ கேக்குறீங்களாமா? You can unmute if you want. You came on video and went away. Sugandhya? Okay, if we don't have any other questions, we'll end this. So let me just first stop the streaming. What? Auntie is pretty good. Huh? The auntie's learned so much. See, you've attended my early Zoom webinars where I was struggling and finding it so difficult. Facebook, madam. You're
Yes,
all
aunty.
IT savvy people.
I attend most of a session, aunty. The timing is sometimes it does not match with my shift timing. That is why. Otherwise, I attend and I follow you, Miss, religiously. I follow your Insta and FB.
Okay, right. Okay, bye everybody. Can medicine be completely stopped? Sukanya is asking.
Okay.
Medicine can be stopped in 70% of patients after 3 to 5 years seizure-free period on medication. Now, unfortunately, though we wait for the EEG to be normal, seizure freedom, everything, in some people, out of that 70, we may not be able to completely stop. But we can bring you down to a maintenance dose and keep you on that. Like both of them are on maintenance dose for a long period. Because every time we try to reduce, they get a breakthrough seizure. So their brains are not yet ready to manage without a medication support. And if it's going to interfere with the quality of life, and if the drug, now modern drugs, many of them are pretty safe in long-term use. Earlier, we had drugs which would affect the liver and create problems and all that. Now the modern drugs are pretty good. They give good seizure control and they're quite safe even in long-term use. So like diabetes, if you have diabetes, you take medicine throughout your life. Like blood pressure, you take medicine throughout your life. So look at it that way. Just don't think of it as something special, something different. Because it's just another disorder, just like your blood pressure, diabetes, whatever. And in fact, it has less complications than diabetes and hypertension. Both are diseases which are full of complications. So it's better to have epilepsy than to have diabetes or blood pressure. Okay. I hope you're happy with that answer, Sukanya. Right. Okay. Bye-bye. Have a great week. Enna edo kekkanuma Venkatesh? Illa, unmute. You're muted. I can't hear you. You're muted.
One more thing, doctor.
Yeah.
The modern medicines are doing real wonders. Apart from that, during the course of this conversation, I came across a word from you that dieting also sometimes helps. That is more.
No, that is for the difficult to treat patients.
Oh. So I just wanted to know whether there is any form of on the diet which epileptic.
No, the ketogenic diet, if you go and Google, it's very, very popular for people to lose weight.
Achha.
But it's not a diet you can stick to for long. And you're a vegetarian. A ketogenic diet involves taking a lot of animal protein also. Okay, so I wouldn't, and you're doing okay. You don't need that.
Okay, thank you. Thank you.
Okay, bye. Bye, everybody.
Bye, auntie. Take care.
Yeah.